Ladies, before your next blood test, pause. Because the 5 mistakes I'm about to reveal could flip your results upside down, scare you with a false diagnosis, and even send you on medications you never needed. And number 4, almost nobody talks about it. I'm Dr. Sarah Collins. After more than 18 years of working with senior women, I've seen how simple preparation errors can completely change what your blood work says. The good news? These mistakes are easy to avoid once you know them. And today I'm going to walk you through each one. By the end, you'll know exactly how to prepare so your results are accurate and your doctor sees the real picture of your health. If you've ever been told your numbers looked off and had to repeat the test, hit that like button. You're not alone. Let's start with one of the biggest, fasting the wrong way. Many women forget they're supposed to fast and grab a light breakfast or a cup of coffee with milk before heading to the lab. Even small things like that can throw your glucose or cholesterol off completely. On the other hand, I've also seen women fast way too long, 14 or even 16 hours, thinking it will help. But that backfires, raising stress hormones, dropping blood pressure, and even making you faint during the draw. The sweet spot is simple. If your doctor tells you to fast, aim for 8 to 12 hours, water only. No tea, no black coffee, just water. That way your results are clean and trustworthy. Quick question. Have you ever accidentally eaten before a test and had to redo it? Comment yes if it's happened to you. The second mistake is taking pills or supplements without realizing how much they interfere. This one is sneaky. Biotin, which is in many hair and nail vitamins, can make your thyroid test look abnormal. Ibuprofen can change kidney markers. Even common steroids raise blood sugar, and vitamin D taken right before the test can push calcium up. The issue is that most women don't even think of vitamins as medicine, but your blood doesn't know the difference. The fix is simple. Write down every pill, powder, or supplement you take, from prescriptions to herbal teas, and let your doctor or nurse know. Sometimes you'll be asked to pause certain supplements for 24 to 72 hours before the test. Don't guess. Always confirm first. If you take any daily vitamins, drop the word vitamins in the comments so others know they're not alone. Now here's one hardly anyone thinks about: not drinking enough water. Picture this. You show up, the nurse ties the band around your arm, and she can't find a vein. She warms your skin, taps your hand, but still struggles. This happens a lot when you're dehydrated. And beyond making the blood draw harder, dehydration thickens your blood, making things like hemoglobin and kidney markers look worse than they really are. The solution? Unless your doctor tells you otherwise, drink a glass or 2 of plain water about an hour before your test. Not juice, not soda, just water. It plumps your veins and keeps your results accurate. Let me ask you, do you usually drink water before your blood test, or do you go in empty? Comment water or empty. I'm curious to see which is more common. The fourth mistake might surprise you: strenuous exercise the day before. Now, I love when women over 60 keep moving. But if you lift weights, do a long hike, or push yourself hard the day before, your blood will show it. When muscles are sore, enzymes spike, and doctors may think you have liver or muscle disease when really, it's just your workout showing up. I've seen women refer to specialists over this mistake alone. What's your favorite kind of exercise? Drop it in the comments. You might inspire someone else watching. What's safer? Gentle walking, stretching, or yoga the day before your test. Save the heavier exercise for after. And finally, mistake number 5, arriving stressed. This one isn't written on the lab instructions, but it can change your results in minutes. If you're rushing in from traffic or worried about the needle, your body floods with adrenaline and cortisol. That can raise your blood sugar, alter white blood cells, and even shift thyroid levels. I once had a patient whose results looked alarming, until we repeated the test a week later when she was calm, and everything was back to normal. So give yourself time. Arrive early, sit quietly for 10 minutes, breathe deeply, and let your body settle before the test. Think of it like weighing yourself. You want the scale to be balanced at 0 before you step on. If you're someone who usually feels nervous before a test, type calm in the comments. Let's see how many of us need that reminder. So ladies, those are the 5 mistakes I want you to avoid. Fasting the wrong way, forgetting how medications interfere, skipping water, exercising too hard, and walking in stressed. They sound small, but they can completely change your results. And when results are wrong, the advice that follows is wrong too. Here's my challenge for you. Before your next blood draw, Pick one of these fixes to practice. Maybe it's bringing water, maybe it's arriving calm. Then come back and tell us if it worked for you. And let's do something fun. Type the word ready in the comments if you feel prepared for your next test, or nervous if you know you need to work on it. This way we can see how many of us are in the same boat. Don't forget, like this video if you learned something new, subscribe for more senior health advice, and share it with a friend who has a blood test coming up. Until next time, I'm Dr. Sarah Collins, reminding you to prepare wisely, stay calm, and let your results reflect your true health.